8:14 on this Thursday, June 25th. It's going to be hot and humid and maybe rain today, just like it will every day in the summertime. Highs near 90. Dr. B joins us now. Our friend Dr. Brent Wallis, Chief Medical Officer of People's Health. How you doing, Doc?
Hey, Tommy. I'm doing great. How about you?
I'm okay. As a New Orleanian and lived here all my life, I forget from year to year, and I was out yesterday, just how daunting the humidity and the heat can be and how it just seems to be pressing you into the ground, doesn't it?
Yeah, I know. We're always waiting for the warmth during the winter, and then it gets here, and we're not too happy about it.
No. In addition to it being a hot month, it is Men's Health Month, and Dr. B is going to explore important issues with us and tell us about some important issues that affect men's health. And I guess, Doc, the first thing is it seems as though most men don't go to the doctor.
Yeah, that's very true and very unfortunate. They've even done a lot of surveys on this. The Cleveland Clinic did one that showed that almost 3/4 of men said they would rather do household chores like cleaning the bathroom than go see their doctor, which is really terrible. Seeing your doctor is really the best way to manage your health and just maintain a healthy lifestyle. So it's so important to get regular checkups and get tested for conditions that you may develop. Prevention's really the key. So we want to change that attitude of men and get them to go see their doctors.
Maybe if you posed it as or positioned it as it's kind of like getting the oil change, maybe we could relate to that better and actually go see the doctor to talk about some of the health risks that we have. What are some of the top health risks that we as men face?
Yeah, there's several. The absolute number one is heart disease. Over half of adult males have some form of heart disease. And that may be something like high blood pressure, but it could be more severe, something like congestive heart failure. And most of that can actually be identified pretty early on so that treatment plans can be developed. And along the same line, stroke is really a huge risk for men, but about 80% of strokes are completely preventable if you change lifestyles, like getting your high blood pressure treated or eating better or exercising. And then the ones that we don't talk about as much, especially in men, unfortunately, is things like depression and suicide. Men are 4 times more likely than women to commit suicide, and rates have been going up in recent years across the United States. It's actually the 10th leading cause of death in the U.S., and that's gotten worse through the pandemic because of social isolation and then a lot of problems that we have accessing mental health care treatment, increased use of drugs and alcohol. So it's an important topic to talk about and something you can definitely bring up with your doctor if you go see him.
I guess it's because sometimes we as men think we're too tough and we're being weak if we admit we have any mental issues.
Yeah, that's one theory, and I think what we have to realize is that it's probably tougher to just go ahead and see your doctor and get something done about what's happening.
What about cancer? Something men need to worry about?
Yeah, cancer is a major problem and a major concern for men. There's really 3 major types of cancer that we see in men: lung, prostate, and colon. And each can be identified early and treated if you catch it in time. Lung cancer, we can't say it enough. We say it on this show all the time. Smoking is really the leading cause of lung cancer, so you've got to get rid of those cigarettes. And African-American men are really at higher risk than other ethnicities. Prostate cancer is actually very common in men. It's the second leading cause of death following lung cancer. And prostate cancer has a lot of treatments, a lot of new treatments that have come out in the last few years as well. So again, identification is really one of the most important things you should do. And a lot of people ask me about screening for prostate cancer. There's a lot of debate about how to screen for it and who should be screened. So that's another thing you should talk to your doctor about, especially if you have a family history of prostate cancer or really any other type of cancer. And then the big one I've been talking about really all year has been colon cancer. It's very easy to detect, and you can completely prevent, severe cancer if you identify it early through either a colonoscopy or other screening methods. And what happened in the last year is we saw a tremendous drop-off in screening because people weren't going to see their doctors. So it's really important to get back in. In fact, the U.S. Preventative Services Task Force that really makes a lot of the rules around who should be screened and when they should be screened just lowered the age for colon cancer screening from 50 to 45. And a lot of people probably remember Chadwick Boseman, who played Black Panther in the movies, actually died last year from his battle with colon cancer, and he was only 43 years old. So that's why it's so important to get screened.
That still has a lot of us shaking our head, and it's hard to believe that this vibrant young man could be gone so quickly at the age of 43. Somebody texted in here, doctor says, I went to the urologist a month ago. Next week I go in for a bladder biopsy scraping. Hope I caught it early, and it's all about catching it in time, so don't be hesitant to go to the doctor. When we come back, we'll talk about, aside from cancer screenings, what are some other screenings that are important to us as men to take care of our health, which a lot of times we maybe take care of the car better than we do ourselves. 8:20, time for traffic now on WWL. All right, 8:24, Tommy Tucker, WWL, talking to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health. And June is Men's Health Month. So we're talking about, and Doc, before the break, I mentioned maybe sometimes we take care of the cars better than we do ourselves. Maybe if we looked at ourselves as a car, then maybe we might realize how important it is to see our doctor. And I guess that relates to screenings, because a screening is kind of like putting it up on the rack to see what's going on, right? If you have any problems before you go on vacation, something like that with a car.
Yeah, I like that analogy, actually. You have to identify what's going on before you can actually fix it. And so that's why screening is really so important, and why you have to go to the doctor to get that checkup done.
So what are some of the other things besides cancer that men should be screened for?
So we do a whole host of things every day in clinic, but some of the big ones that we always look at is, of course, cholesterol. Cholesterol can lead to heart disease and stroke and a whole bunch of other problems, vascular type problems. So all men age 35 and older should get their cholesterol checked at least once every 5 years. And then when you get to age 50, you really need to have it checked once a year. And that's true also for anyone who has high blood pressure or diabetes already. That should be checked every year. Blood pressure, I mentioned, that's critical, and it's checked every time you come in to the doctor. High blood pressure does not cause any symptoms in most patients unless it's really, really high and severe. So that's why it's important to get screened for that blood pressure, because we can treat it and actually prevent any of the later consequences. And then, you'll note, too, when you go to the doctor, we always put you on a scale and we check your height. What we're doing then is we're actually calculating something called a body mass index, or a BMI. And BMI kind of tells us if you're at risk for other health problems, in particular things like diabetes and high blood pressure, like we've been talking about. And then the last one really that's a great simple blood test that we do is called an A1C. And that's a screen that we do to diagnose either diabetes or even pre-diabetes. So we can actually tell if your blood sugars are running a little bit high and you're predisposed to developing diabetes later in life by checking this A1C. So it's really recommended that after age 45, everyone should be screened with an A1C to rule out diabetes. Or if you're under 45 and you're overweight or have any risk factors or family history, you should be screened as well.
All right, so it's Men's Health Month. Are there things we as men can do to improve our health that maybe don't involve the doctor?
Yeah, definitely. I think living a healthy lifestyle, we say it a lot, but it really is critical. Making sure that you get your checkups is paramount. You absolutely have to go see your doctor occasionally so you can identify these things. But even more than that, you talk about it a lot. Getting enough sleep is extremely important. It gives your body time to heal overnight. And recommendation is really to get between 7 and 9 hours of sleep per night. And a lot of people don't do that. I can't say it enough. Get rid of the tobacco. There's a lot of risk associated with it, including heart disease and cancer. And it's bad for you, so it's time to stop. And then move, get out, exercise, whether it's moderate exercise or really light exercise. It can just be walking around, and that can be very difficult during the summer months because it's so hot outside. So maybe jump in the pool or do some things around the house to just get yourself moving. And then really the other critical one is getting a handle on stress. You know, we have a lot of stressors in our life, and stress does take a toll. It can raise your blood pressure. It can raise your blood sugars. So it's really important to kind of, you know, take a break from everything that's going on around you. Stop, you know, sometimes put your phone down, stop looking at social media, exercise a little bit, and find something that you really enjoy doing.
And you got to watch what you eat too, right? You can't just exercise and then think you can eat whatever you want.
Yeah, definitely. Diet is always important. So, you know, steer clear of some of those fatty foods and really try to eat a healthier meal with more vegetables and fruits and whole grains in it. And you can splurge every once in a while, but in general, you really want to watch what you're eating.
Doc, I want people to listen. I don't want to get them mad, but for the people that are still smoking, and I know I've heard a lot of men say it, well, something's got to kill me. Just address, if you will, the importance of getting off of that tobacco and how it's not going to be a quick, clean death if you think it's going to be a heart attack that takes you all of a sudden. And I witnessed it with my parents. It's going to be years and years of weakness in the final years of your life.
Yeah, it's definitely much messier than a lot of people realize, and so it really is critical, and it's time for people to just stop smoking. You know, that really goes a long way to improve your health in so many areas.
You're going to be in a wheelchair, you're going to be breathing through a machine, and it's not going to be nice. Thank you, Doc. I appreciate your time as always. Hope you have a great weekend.
Thanks, Tommy. You too. Thanks, Tommy. You too. Thanks, Tommy. You too. Thanks.